Hello, I'm Dr. Basil Constantine. I'm here from the ACU Online Writing Center, and today we're going to be talking about SWOT analysis. If you're not familiar with the Writing Center, we work with students in all of ACU's online programs, just about, and we are happy to work with you through webinars such as this. You can come to see us through various appointments. You can schedule an asynchronous appointment, meaning you upload your draft, we email you feedback. You can request a real-time appointment via phone or Zoom by sending us an email at onlinewritingcenter@acu.edu. And you can also find many other things, including templates, sample papers, and a complete complete selection of our webinar recordings on the Online Writing Center website. Here is a sample of the webinars we have coming up this evening, Tuesday, September 7th at 7 o'clock. We have Avoiding Plagiarism with APA 7. We have next Tuesday an undergraduate student drop-in writing support thing, and you can see a number of other things for the EDD program and the CONR program coming up. You'll see me using the APA course paper template, which is linked at the first link here, and you can find videos on the YouTube channel if you want to be browsing on the go, waiting for a bus stop, want to watch a video. We upload those to our YouTube channel as well. And we also have a blog with explorations of different topics. So here are our main objectives today. We're going to delve into SWOT analysis. Then we're going to specifically look at how it comes up in Nursing 622's Week 3 Assignment 1, Planning at the Organizational Level, the SWOT analysis. And then we're going to finish by addressing some common questions and concerns that have come up with this analysis. Now, a few preludes before we dive in. Of course, if you're doing this assignment, you want to do the reading in advance. That goes into much more detail than I'll be covering today. I'm mainly focusing on the mechanics of how to write this assignment, how to perform an analysis, and how to format things in APA style. So first off, what is SWOT analysis? So SWOT analysis, the S stands for strengths, the W for weaknesses, the O for opportunities, and the T for threats. So it's a way of sorting your thoughts when assessing an organization, an individual, an opportunity, a potential business or other establishment that you might create, to determine, all right, well, where do we stand vis-a-vis this? What are we prepared to do? What are we less prepared to do? What do we want to work on? How can we grow? What are the things we need to really pay attention to? And by having this systematic way of assessing and categorizing characteristics of the person or the organization, the idea is that you can perform a quick strategic analysis and determine, is this something where we are prepared to do whatever is important to us, whether that's an individual applying for a job or an organization looking to see whether they are meeting the requirements for certification or anything else like that. And the basic element of a SWOT analysis is that you divide information into 4 categories: the strengths, weaknesses, opportunities, and threats. And this is usually presented in a simple 4-part matrix. And you can do this up using a table. You can organize it in a number of different ways for readability, especially if you have multiple SWOT analyses that you're putting side by side, say for each objective or programming area that you have. You might have a separate one and you consolidate these into a larger table, but the essential thrust is the same: to break it down into these categories for understanding who or what you or the organization is. So a couple examples of different SWOT analyses, and you'll see that this first one has a series of 3 to 5 pieces of information in each category. And you can see that the strengths, weaknesses, opportunities, and threats, it's condensed to short phrases so that the readability of this, so we take out information. We know we're talking about the strengths of this organization. So just offer specialized procedures that no other facilities in the state can. Okay, great. And that's all we need here. You don't need to have a full grammatically complete sentence because these are essentially crib notes. Now, one feature of this particular SWOT analysis is it comes with the 3-sentence summary here, where they're giving kind of a bird's eye view. Okay, strengths are highly unique compared to other hospitals in the region and are a differentiator when patients are looking for this procedure. Weaknesses demonstrate there is an opportunity to eliminate patient flow bottlenecks by having better trained doctors and staff. Despite current profits, revenue could be higher with strategic improvements. All right, so that's a brief analysis of the information in the matrix. An analogy I might make, when you are writing a paragraph, you present evidence, but you also need to analyze that evidence and ultimately synthesize it to create new meaning. What does this mean when put together? And the summary here is doing that. Hold that thought when we come back to the assignment. Here's another example that has a little bit of graphical touch and color coding, but it's the same basic idea. We have these short bullet points distilling the strengths, weaknesses, opportunities, and threats. Note that some of these things, parking will not be relevant everywhere. I have lived in cities where parking was plentiful. I have lived in cities where parking is opposite and expensive. So for example, if we were writing in the city of Boston, and well, parking is extremely important there because there's not a lot of it, it's expensive, and you might spend more time looking for your parking space, even if there's a parking structure, than in your appointment itself. So convenient parking could be a strength if it's something that's well known, but also an opportunity if it's something where you don't have an arrangement to validate parking, or you haven't advertised that it's on the website. So depending on the state of things, you might have something that will appear in more than one area, or that might be classified under one depending on how far it's been developed. And so one of the goals of the SWOT analysis could be identifying opportunities that you want to turn into strengths. So for example, there is a college in my area that had underutilized equipment. And then in the current pandemic, they temporarily loaned this to a local medical center. And one of the things that this helped do is it gave them a strength of increased visibility for the program. They took that opportunity, that underutilized equipment, and turned it into a strength. And so that might be something that you talk about in your analysis. Here's another example. So this is what we call a multi-layer SWOT analysis. And you can see that it has an additional column here, theme, where they're talking about the distinct strengths, weaknesses, opportunities, and threats of things within that theme. And they have also sorted it so you have related information on the same level. So this is not the kind that you're going to be doing in this assignment, but it is an example of how you might take this a step further if you're doing a multi-part or multi-disease analysis at a particular medical facility and other things like that. So if you move higher into the administration, and you're not focusing just on one particular ward or department, then you might find yourself reading or creating something like this. All right, so let's look at the specific assignment today. So this is, again, for Nursing 622, the week 3, assignment 1, planning at the organizational level, the SWOT analysis. And the instructions are fairly concise. So let's go look at the preamble. When considering the future success of a plan change or quality improvement project, it is helpful to align the change with the organization's capabilities. Now, I will just say, as you continue this program, you will be writing things about plan changes and quality improvement projects. So in part, this is giving you a mechanism for something you can use when you are eventually writing that QIP. Assessing an organization's strengths and weaknesses, as well as the opportunities and threats for a desired objective, will assist in the success of the project. Conversely, when auditing quality improvement, it may be useful to complete a SWOT analysis to determine threats, to explain poor performance or compliance, and opportunities for improvement. So this is basically saying that when you're doing the analysis, it's not just about looking and seeing, all right, what do we do to succeed? It's also about looking and saying, okay, well, what isn't going as well as we like? And having that objective measure is a helpful thing. There are some QIPs that will do a SWOT analysis before and after and see have things changed. And that's certainly a fine way of comparing things. So going down to the specifics for this assignment, you're going to be using the performance measure that you selected for week 1 assignment. And so you need to identify that and define it, clearly define the performance measure objective. And then the main part of this, construct a SWOT analysis, identifying attributes and conditions that promote or challenge the organization in meeting this objective. And each item in your analysis specifically needs to include a minimum of 3 attributes or conditions related to the desired objective. So that 3 to 5 range, it's a good ballpark. If you're going above that, you are probably doing it too nitty-gritty and losing some of the big picture. The SWOT analysis is a more concise measure. It's a way of getting that snapshot view. It's usually not intended to be exhaustive, because then other ways of organizing the information start being more effective. And there's a specific note here that you should have a minimum of 12 considerations. So at least 3 things in each of the SWOT areas. And then you need to analyze the SWOT assessment and determine if the objective can be achieved. So whatever performance measure objective you have chosen in the previous week, you're now going to take this and analyze an organization and see, well, is this doable for them? Now, there is in Canvas, you'll see that it links you to a SWOT template. But I do want to point out to you that that example template is formatted for APA 6, not APA 7. And if you're wondering, what's the difference? What is that going to look like? I'm glad you asked. We're going to be getting to that in a few minutes. All right, so let's look at the rubric. And this is a fairly concise thing, but let's check. So clearly define the performance measure objective. So don't just state our objective is X. Tell us what that means. What was it going to look at? Because that's about 15% of the grade. So make sure you give us a good description, definition, explanation of what the performance measure objective is. What are you trying to do? How is that going to be measured in practice? And this is, again, calling back to your week 1 assignment. Second, construct the SWOT analysis. So this is making up the table and everything and identifying what's promoting or challenging the organization and meeting this objective. And then specifically having at least 3 attributes for each area. So that's a large part of the grade. That's 50% of the grade. So make sure you have at least 3. Having 1 or 2 in each area is not going to be helpful. All right, then you need to analyze the SWOT assessment and determine if this can be achieved. And you can see from the number of points here, that's 25% of the grade. That is something that you should be doing more than just a brief sentence or 2. Don't just say, oh, yes, that it is clear that it can be achieved. Tell us in a paragraph or 2, possibly even a whole page, about what makes this achievable or not. And you can, by all means, discuss things in the SWOT analysis. All right, now we're going to talk a little bit about some of the things I get questions about related to this assignment, starting with how to cite and reference some of the sources. So a good go-to, if you don't have a copy of the APA 7th edition manual, is to go to APA Style Central. I've linked their references example page. So actually, I'm going to come back to the slide in a moment to talk about the sources first, and then we'll come back and get the other one. So first off, if you are citing the course textbook, it is a edited volume, meaning in this case, there's a pair of editors who oversaw the creation of the whole volume, but each chapter has a different writer or writing team. And so there's a particular format that you want to be citing that in. The syllabus refers to the 2017 hardcover version of this book. I cited the 2019 paperback because that is the one that I'm seeing students having actually bought. But if you have the hardcover, it's mostly the same. Just make sure, for example, you have the 2017 publication date there. but you should be citing the specific version that you're using to make sure that the page numbers work for you, that they align with the specific source you used. So this first example, I've taken the 4 chapters that were recommended for the week 1 assignment and presented them here to you to see how that is supposed to look. You can, of course, introduce additional resources. And if it happens to be a book chapter, you'll follow the same model here. So we have the authors of the chapter. For the first one, that's Melnick and Neal. We have the title of the book chapter, Key Strategies for Optimizing Personal Health and Well-Being, a Necessity for Effective Leadership. Note that that is in sentence case. Then we have in, and then the editor's names. Note that that's initials first, not last name, comma, initials. This is a particular thing when you're listing book editors. And then we have EDS, meaning editors, in parentheses. Then the title of the book italicized, also in sentence case, the page range. And then we have the name of the publisher, which is Springer. So you can see here that Melnick was not just one of the editors, but also the lead author for several of the chapters, but not all of them. And so when you're citing these, you just use the authors for that chapter. The editors don't normally appear in the citation unless they happen to be an author for that particular source. All right, so one of the reasons this is important to come up is if we look back at the week 1 assignment 1, you'll see that it's referring to a set of acceptable performance measures and offers that you can and use a different one if it's approved by the professor. But in this case, we want to make sure that you are carrying forward information from that assignment, including the name of the performance measure. So you're going to be working with this same one, the name of the organization that created the performance measure. This is not the one that you're analyzing. It's, okay, who created this? And if you're wondering why they're not created by individuals, because these ones that are created or published under the imprimatur, under the name of a different organization, they have greater weight. Like CMS, that's coming from Center for Medicaid. So that has a particular weight as an official measure. The NDNQI is one of those industry standard things. The American Heart Association, of course, is one of the leading authorities, is as a professional organization about things like congestive heart failure. So it's important to indicate, okay, who came up with this, and why is this being used, which is the third part, the rationale of at least 250 words. Now, you're not going to be copy and pasting from the week 1 assignment, but a lot of the ideas there you'll be extracting and using in the week 3 thing, because again, as the assignments indicate, you should be defining the performance measure objective. Okay, so that should be related to what the measure is. So some of that will come back. And then some of it will also come about when you are assessing if the objective can be achieved, because in the descriptions of these measures, they will usually talk about the characteristics for success and the things being measured. More on that in a little bit. All right, so if you are citing one of these external measures, it's important to know what you are looking at and how it's cited. Now, there's some details about the particulars that you can find by looking at the specific examples, but in the end, it comes down to the same sort of questions. Who wrote it? When was it published? What's it called? How do you find it? So let's say you had written your professor in week 1 and said, you know what, I actually want to use the Joint Commission's National Quality Measures for Pneumonia, not the Centers for Medicaid Studies. Okay, and if your professor approved that, not a problem. So I've included a link to that web page, and well, we're just going to cite and reference it as a web page. So who wrote it? In this case, we have the corporate author, the organization, the Joint Commission. What's it called? The Specifications Manual for Joint Commission National Quality Core Measures 2010 A1. Now, if you're wondering why Joint Commission is capitalized in the title, well, because that's part of the proper noun. And Joint Commission National Quality Core Measures is a metric, a measurement tool and we capitalize those in title case and APA style. And then we have the link to it. So that answers the key questions. Who wrote it? When was it published? What's it called? And how do I find it? Now, you might say that, hold on, isn't this something that was published in 2010? Well, the answer there is if we go to the page, there's nothing that says it was published in 2010. We have the catalog number 2010, which suggests that, but this isn't always the case. You might think, for example, about the US Census results. Well, the census was last conducted in 2010. We still don't have the full data for that available yet. It hasn't been published and made available, in part because there's a lot of quality checking, removing duplicates and things like that going on. And so while it may be the data for a particular year, that doesn't necessarily mean that it was published there. And since this web page does not have a clear publication date, then we put N period, D period, which is for the Latin non datum, just means no date. There's no date there. And so how we would cite this, the Joint Commission, N period, D period. All right, so let's say we were going with the NDNQI patient falls indicator. And this one, we're going to take a moment and we're going to look at that PDF because I think it will illustrate some of the principles that we're discussing here. So I'm going to change my screen sharing over here so that we can see those guidelines here. And you'll see that we have a couple things. So this is dated January 2020. Great, we've got our year. NDNQI is listed as the author. NDNQI is an entity within Press Ganey, as it explains up here, but listed as the author is NDNQI, so that's what we're going to use. 2020 is our publication year. Here's our title. It happens to be in title case here. We will present it in sentence case because that's what we do in APA style for title of a report. And the rest we're not going to worry about. All right. So let's pop on back to our slides here. So you see we've got the who wrote it, that's NDNQI. When was it published? 2020. What's it called? Guidelines for Data Collection Submission on Patient Falls Indicator. And Patient Falls Indicator is the name of the test, the measurement instrument. So that's why it's in title case. Again, we capitalize surveys, measurement instruments, quizzes, that kind of thing in title case in APA style. And how do we set it? NDNQI, comma 2020, or NDNQI with 2020 in parentheses. All right, so let's talk about that SWOT table. I mentioned that the example online is in APA 6th edition. And if we look at the syllabus for this course, it says all formatting and reference should follow the publication manual, the American Psychological Association 7th edition. And we've got a paper template that's prepared if you are just writing up a normal paper, but we don't have an example of that template for the SWOT table. Or shall I say, we're not going to have one until we're done with this presentation because I'm going to show you how to build it. And then I'm also going to post it for download on the Writing Center website. So if you get this video via email, you'll probably have a copy of the slide deck and a copy of that template to use. So just be aware, standards are changing all the time. If you're working at a hospital and they say, well, the insurance company has changed the requirement for this to get reimbursed, we need to code it this way. The guidelines may take, the printed guidelines may take a while to catch up, but we're adapting it. And that's a similar thing here. The example online shows you the basics. We're just going to modify that so it looks right for APA 7th edition, so you don't worry about losing any credit there. All right, and again, I recommend that you download the APA course paper templates so you can follow along as we go. You can grab that from the online Writing Center website. Now I've loaded up the Writing Center website here. I've gone to that page that was linked, and the template you want is this one at the top, the APA course paper template. So go ahead and download that, and then we'll talk through things together. And to show you the APA 6th edition template version, if you click on this link here on the assignment page, you'll see that we have a couple things. So this running head, this element here, running heads were done away with in APA 7th edition. So we're not going to have that. There's some minor changes to how this is formatted in APA 7th edition versus APA 6th. No running head here either. And then we're going to talk about how this table here will look. And I think at this point, let's just dive in. All right. So the template file that's available on the website is actually a Word document that you can download. So I've actually just pasted in here. And so there are a couple things that we want to do here. One is to conform the naming here. So if in APA style, you have an appendix that the whole thing is just a table, and then you put the title, rather than having a separate, table 1, SWOT analysis, we actually name the appendix X this. So in this case, we're going to take that out, delete that. Now we have this reminder note here. So we're just going to delete this. We'll come back to that later. And let's talk about how a table looks in APA 7th edition. So one of the characteristics of an APA 7th edition table is that we only have horizontal lines, no vertical ones. And you can see we've got some on the left and the right. So what I'm going to do here is I'm going to go to our table layout here. You can see that there are different options where you can resize this. Don't worry about that. Usually you want to just have auto fit set, because auto fit makes sure that things fit and make the best use of the space. In this case, we're just going to start and have it evenly spaced so that we know how it compares in terms of volume of information. You can always apply auto fit later. For this particular thing, just seeing how much we have in each category, it's a little bit easier this way. All right, so the spacing has been turned down to 10-point font. That's allowed in APA style. It just helps you fit a little bit more information on each line. So go ahead and select the table. And you saw I'm clicked into the table and there's this little button here. So if I click on that, that selects the whole table. Now, if I go to table design, we have a number of ways to adjust the borders, one of which is through this button here. And we can turn off the left border. Turn it back on by clicking again. So turn off the left. So you always want to be clicking this chevron here, turning off the right. And now we only have horizontal lines. Great. So this is now an APA 7 compliant table. So let's start putting something in here. And let's say, let's, for the sake of illustration here, let's say I am assessing a hospital here. So I'm going to pick a hospital that I've worked at. This is a level 1 trauma center. And let's call this and we'll start putting things in, and with bullets, okay, this is going to be preeminent level 1 trauma center in county. Newly upgraded facilities, efficient staff, high retention, and you can go on and list these things. Now, it's important to keep in mind what is the goal of the analysis. So let's take a moment and pop back to the assignment instructions here. So we look up here, okay, what is the objective? Because which strengths, weaknesses, opportunities, and threats we list is going to depend a bit on the specific objective we're pursuing. Regions is a big place. There's lots of stuff going on there. They have things like, say, a service where you can, if you're seeing someone there for medical care related to pregnancy, they will install your car seat for free. That's a really nice service. Is it a strength? Yes. Is the strength relevant to, say, are talking about how this is a good destination for COVID patients? Probably not relevant. Hopefully not relevant. So, make sure that your objective is in mind here. So let's say that we were talking about the falls system. So now if we look at this and see, okay, that's a level 1 trauma center, great, newly upgraded facilities. So one thing, if you're tracking falls, you want to make sure you catch them, know where they're happening, and then intervene accordingly. So if we said, oh, newly upgraded facilities with full common area video surveillance. Now, of course, you don't want to have cameras in the patient rooms and stuff like that, but corridors to spot someone falling and be able to get help in there, that was something that in this case might go in as a strength. Now, when you're assessing the weaknesses, you might go in and say, well, okay, staff attend an average of 6 trainings a month, say. And why would you be putting there? Well, if it's distracting and this is going to be one more thing that they're going to have to do, well, the fact that they're already greatly subscribed here may be something that you described as a weakness. What are the opportunities? What are the threats? Well, in this case, and say, well, upgrades or recent upgrades. So say, oh, well, we are the preeminent in our county, but next county over. And so we might say, okay, adjacent. So it's not in our county, but it's close by. And they've also been upgraded. So that's one of those threats here. Opportunities, say, oh, newly added and underutilized wing. And you go in and fill these things in as you go. So let's talk about that thing in the note. And let's just walk back to the APA 6 template that we were looking at earlier. So you can see down here, it says, make sure to reference this appendix in your analysis. So how do you do that? That's very simple. So in the course paper, when you're writing a paragraph, let me just clear out some of this placeholder stuff. You would just write a reference to it according to the SWOT, if you're writing it out that way. And in this case, it wouldn't be a proper noun. It's just saying I did an analysis and it's happened to be a SWOT one. And you have this C appendix. Now there's no appendix A, no appendix B, because it's the only one, and so you just write appendix. And then give us some discussion of that. Okay, according to SWOT analysis, there are many weaknesses. Now you want to be specific, okay? So okay, there are many weaknesses related to this specific thing that we're trying to do. So just make sure that it's not just to say, oh, there's an appendix there, but reference a particular part of it. In this case, we're referencing the things that you populate in the weaknesses area. Now, reminder, minimum 3 to 5 bullets in each area. Think about this. So try and make sure that those are very relevant to what is being done. Oh, I'm sorry. I think I had the wrong screen shared there. Just a moment. There we go. yes, so make sure that when you are typing this, that you have a clear reference to the text involved. So, for example, this text here, according to the SWOT analysis for Regents Hospital, see appendix. Again, not appendix A because we just have one. It's just see appendix. There are many weaknesses related to measuring and improving fall prevention. So that's giving the reader important context. So they don't have to flip to the appendix to see that whole analysis, but they can if they want to. There's enough to ground them to see what you're referring to here. All right, so again, you want to make sure that you have at least 3 to 5 bullets in each category here for strengths, for weaknesses, for opportunities, for threats. And so you have a nice full description and you can really do a bird's eye view. Some people will start writing the paper and then do the analysis. I'm going to recommend the opposite. Do the analysis first. That helps you focus your thoughts and lets you write your paper much more directly and concisely because you have an idea of what you're going to be talking about and is this something that you think can be implemented here. So with that, let us head back to the slides and do a quick review here of what this assignment is asking for. So define the performance measure objective. This should be the same one that you used in week 1. So tell us what it is, what's the measure that's being used, and what's the objective related to that. So for example, at Regions, we could say, oh, we're trying to decrease the frequency of falls in this patient population from this to that. And as part of our SWOT analysis, we might go in and say, oh, okay, so what are the conditions that promotes this is we're already tracking falls. And maybe the thing is the measure says, well, here are these different types of falls, which actually is something that is tracked in the measure we're looking at. So we say, oh, well, we're already tracking an aggregate, but there's this opportunity to go in and classify these in our reporting because the raw data is in the patient records. We just haven't bothered to be using that beyond counting the frequency of the gross category. And all right, next on our list, make sure you have at least 3 to 5 for each of those things related to the desired objectives. So there are other things. I happen to think Regents Hospital looks pretty nice and as food goes, has decent food for a hospital. Probably not relevant strengths for this. So make sure that they are relevant to the objective, in this case, fall prevention. And all right, make sure that you analyze the assessment and that you pass judgment and say, can this objective be achieved or it is not likely to be achieved. And you can see our guidelines here. That's 3 to 4 pages of main content. So that's not the title page, it's not the references, it's not the SWOT analysis, 3 to 4 pages. And you want to have some sources. You're probably going to be referring to the textbook and probably going to be referring to one of to the performance measure source. Actually, let me rephrase it. You absolutely should be citing and referencing the performance measure because you'll be discussing it. And according to APA rules, you thus have to cite and reference it. You could be citing a related article. Perhaps you've read someone else's QIP and you're using that as part of your model. That's okay. But regardless, whatever it is, make sure it's cited and you're supposed to have at least 2 to 3 sources that should be less than 5 years old. So that less than 5 years old, if it's something where the most recent guidelines haven't been updated, that's usually a defensible thing, but you would want to clarify in your writing that this is the most current thing available. And if you're unsure whether it is the most current or not, you can always write your, excuse me, you can always write your, the library and ask for assistance in researching that. All right, hope that's helpful. And with that, let us bring things to a close. Feel free to write us if you have any questions and schedule an appointment if you'd like to get some feedback on a draft. Have a good rest of your day.